morning, everybody. Thank you for joining me. Maybe we'll give people a couple of minutes. I'm going to give you a little bit of an introduction about me. So I am Emma Green. I'm a physical therapist. You can probably tell from my accent that I am from the other side of the pond. So born in the UK, raised in the UK, trained in the UK. I worked over there for a little over 10 years before coming over here. And I had to jump through all of the hoops to get my PT license over here. That was 15 years ago now. So I've been a PT for a very long time. Looking at some of you, probably longer than you've been alive. So, but now I am living and working in Pasadena, and we moved into CrossFit Crown City about 6 weeks before all of this happened. So we were in for 6 weeks, and then obviously we've been closed down since. But we are doing virtual visits, so we're 100% virtual right now. So as we're doing Zoom calls for CrossFit, we're doing Zoom calls for physical therapy and clinical Pilates. All of our classes are on Zoom. So I wanted to thank you for joining me this morning. I hope you're going to get a lot out of it. I love questions, so if you have any questions, feel free to pop it into the chat, because if you're anything like me, if you try and wait for the end, you'll probably forget what you wanted to ask anyway. So if you do have any questions, pop it into the chat. If it's a super burning question, you should be able to unmute yourself and you can ask me. If I'm not explaining something well enough as I'm going along, stop me and let me know, and we'll go through it in a little bit more detail. Whatever works for you guys. So just before we start, I want to just ask, does anybody have sciatica right now? Is anybody suffering right now? Yeah, kind of, you nodding heads a little bit, kind of, yeah. And has anybody had sciatica in the past? I mean, yes, yeah, me too. I've had it, I've felt it. So basically, sort of the stats for back pain and sciatica. Morning. Back pain and sciatica, certainly for back pain, the stats say they reckon about 80% of the adult population will have back pain at some point in their lives. Now, for me, I've never met anybody who doesn't have or hasn't had back pain. So for me, I think it's like 100% of people. I mean, I can remember I had back pain when I was like in my early 20s. I think I was either a PT student or I just started work, and I can remember lying myself on the floor at night because I was just so uncomfortable. So I'm pretty sure most of us at some point will have back pain. So I am going to share my screen with you. And then we will go into presentation. I'm going to begin. Can everyone see that? Yep, perfect. All right, so that's me teaching at Athleta. You might recognize that, that's in Old Town. Obviously they're closed right now too. But they do free community classes every Saturday morning, 8 till 9. And they do all kinds of different, they'll do HIIT, they'll do Pilates, which is obviously what I was teaching. I did a Pilates for runners class for them. All kinds of aerobics, yoga, everything and anything. It's free to everybody. So you just show up and they give you snacks, and there's always the opportunity to win a gift card. They do like $25 gift cards, so then you can even shop too, which is kind of nice. So that's me. And this is a little bit of, I suppose in some ways, this is like my previous life and my current life. So right in the middle there, you can see we do a goat yoga event. Every year we do it as a fundraiser. So that was not last year, the year before. Top right, so in my previous life, when I was working in the UK, I did a lot of sport. That was really my main thing. That I was working with sports teams, traveling all over the world, doing all kinds of different things. That's the main sport that I work with is actually field hockey. And that's the Great Britain team just after they won the 2016 Olympics. So that was probably one of the best moments ever. Bottom right, I don't know if you can see him behind it, depends what your view is like. That's one of my patients from over here. Buddy, he's super happy for me to share his story. He is a professional drummer. When he first came to see me, he couldn't drum, he was just so uncomfortable. He's now back playing and composing and doing everything he wants to do. Bottom left, we've got Jay, who he came to see me beginning of this year, well, end of last year, because he wanted to go skiing. And he'd been the previous year and had not been able to ski at all because he just had sciatica the whole time he was there. So he had a miserable 3 days, barely was able to get on the slopes. And he said, you know, I'm going again this year. I want to be able to just snowboard and ski and do everything that I want to do. I don't want to be uncomfortable at all. So we worked together for 2 or 3 months. He sent me this picture from his most recent ski trip, and he was like, I skied every single day for 5 days, not a problem. He said, like, I could have stayed longer, no issues whatsoever. He just did so well. And then you probably recognize where that top left picture was taken. That was when we first moved in, and there's some of the clinical Pilates students that are working with me right now. All right, so what is sciatica? I hope you can see that. If you can't see it, I think you can probably, if you hover over you can move it out the way. You kind of move so you can see the picture. So this gives you a really nice visual of the sciatic nerve, what it is and where it is in the body. So we're looking from the back here. So if I kind of turn this around. So this is obviously the pelvis down at the bottom here. This is a back view. So when you run your finger down the middle of your spine, you feel these bony bits. That's right down the center of the spine. You've got your sacrum at the bottom. That's the triangular bone at the bottom. Now, on my little spine here, you can probably see these yellow things that are kind of popping out at the sides. They're the nerves. Now, obviously, they're not that short. You can see on the picture, they all join together and travel all the way down the back of the leg. So that big yellow nerve, it is the biggest nerve in the body, the sciatic nerve, and that's where it goes. It travels all the way down the back of the leg. At the back of the knee, it splits into 2. You've got one branch that goes down the outside of the calf and into the foot on the outside of the foot, and the other branch travels on the inside of the shin, very deep. It's quite a deep branch of the nerve, that one. It goes all the way down to the ankle, around the inside of the ankle and underneath the foot. So that's where the sciatic nerve. Now, the sciatica is basically an irritation of that nerve, and that can be caused in many different ways. So we're going to look at the different things that can cause it, because many people, as we've seen, can have sciatica, but it's not always the same cause. There can be different things that cause it. So we're going to investigate each one of those things. All right, so all of these different anatomical structures can be causes of sciatica. The discs, the joints, ligaments, muscles, and nerves. So to go into each of those in a little bit more detail, if I swing this round again, now we're looking from the front of the pelvis. So we're kind of looking through the stomach here, and you can see the low back. So we've got all the lumbar vertebrae on top of one another. So there are 5 vertebrae that make up the lumbar spine, the low back. The discs are in between. So they're sort of the smaller things that you can see there, they're the discs. If we were to kind of slice through a disc and look down on it, you would see it's a round ring, sort of like a round ring of really tough cartilage with jelly stuff in the middle. And that jelly stuff kind of moves around as we move around. It's what gives our back sort of the mobility that it has. But what can happen depending on our posture, if we spend a lot of time sitting and a lot of time in that sort of C-shaped curve, what that does, take that into a C-shaped curve like that, you can see it puts a lot of pressure on the front of the disc. So the jelly stuff kind of migrates towards the back. If that jelly stuff is pushing towards the back wall of the disc enough, even though it is tough cartilage, it's going to start bulging. It's going to start putting enough pressure on the back wall of that disc to create a bulge. If that bulge gets big enough, I don't know if can you see that red one down there? That's a bulge of the disc. You can see that it's not very far away from the yellow nerve. So if you get a bulge at the back of the disc that's big enough, it is going to push on that nerve, and that's where the nerve root exits the spine. And as I said, it's not that short. They all join together to become the sciatic nerve and go all the way down the leg. So a disc, a bulging disc, can absolutely cause sciatica. Now, you probably heard the term slipped disc. These discs, they don't kind of slip in and out. They are really firmly fixed to the bones. So the disc itself is not going to slip in and out of the spine. It physically cannot do that. But slipped disc is kind of the term that we use for a bulge that's pushing on the sciatic nerve or pushing on one of the nerve roots. Sometimes if the bulge is severe enough, it can start to create little cracks in the cartilage. So the round ring of really tough cartilage that we were talking about, it has layers like an onion. It always makes me think of Shrek when I say that. So it has layers, and those layers can get cracks and fissures in them that the jelly stuff can migrate through. And sometimes the jelly stuff can come all the way outside of the disc. That's when we would call it it would be a herniated disc if disc material is outside. Now, if that happens, obviously, again, you can see it's very close to the nerve, and it can really irritate that nerve because it's not supposed to be there. So if you have any disc material pushing on that nerve, it's not supposed to be there. That can cause sciatica as well. The joints can cause sciatica. If we look at the back of the spine again, you can see that when one vertebrae is on top of another, you get two joints, one on each side. So these are the facet joints. So there's one on the right, one on the left. And again, those joints move as our spine moves. Now, if you have any wear and tear changes, arthritis, that type of thing within a joint, that can cause swelling. Again, the joint is right next to the nerve root where it comes out, and any kind of swelling can also irritate the nerve. Ligaments can do that too. Basically, ligaments are a connective tissue that hold bones together. So the easiest ones to think about are the ligaments around the ankle joint. If you think about when you roll your ankle joint, if you were to roll your ankle joint, you're essentially spraining those ligaments. So you're tearing a few of the fibers. You're not, in most cases, you're not snapping it completely, but you tear a few of the fibers. That's what a sprained ligament is. And when that happens, it swells. Again, thinking back to that ankle roll, it will blow up like a balloon. If you get a sprain of the ligament that holds those two bones together, that joint, that facet joint, any swelling around there, again, can irritate the nerve root. Moving a little lower down, if we look at where the sacrum attaches to the pelvis, you've got your sacroiliac joint. You can see as well that the nerves around that area pass very closely to the sacroiliac joint. You can have a problem with the sacroiliac joint or the ligaments that hold it together, and that can cause irritation to the sciatic nerve as well. So it's not necessarily a facet joint that's causing the problem. It could be the sacroiliac joint. Muscles. You have a little muscle right at the back of the hip, at the back of the pelvis, called piriformis. You've probably heard of that one. Piriformis is quite a small muscle at the back of the hip. It's quite deep inside, but it's one of the muscles that is quite associated with sciatica, because in a portion of the population, not everybody, but in about 30% of people, the sciatic nerve actually travels through piriformis as it's exiting the pelvis. Now, if your piriformis is tight or goes into spasm, you can see it's going to pinch on the sciatic nerve, and that can give you sciatica. So you can get sciatica that is not caused by the spine. It can be lower down, and piriformis can be one of those structures that can do that. If you are part of the population where where the sciatic nerve is not going through piriformis, it's traveling underneath it. So it travels quite closely to it. And again, if that muscle is tight, it is going to push onto the sciatic nerve. So piriformis sometimes is quite a culprit in sciatica. The nerve itself. So the sciatic nerve itself can become irritated. A nerve is a soft tissue like anything else, like a muscle or a joint, or a muscle or a ligament. It's a soft tissue. Now, soft tissues can shorten and tighten. They kind of adapt to the stresses and strains that we're putting through them. So, for example, if you've if you've not stretched out your pecs for a long time and you do lots and lots of work on kind of building up those muscles, but you don't stretch them out, they're going to get tight. Similarly with a nerve, you know, if you're not stretching a nerve out and you're not mobilizing a nerve, it can become tight, and you can get a tension within the nerve itself that can then become irritated and uncomfortable. So sciatica is very much an umbrella term, but there can be lots of different causes for it. So does anybody have any questions at this point? I know I've kind of gone through a lot there. I've thrown a lot of different things at you. Feel free to unmute yourself if you have any questions.
So you were saying for like the disc, if you tend to sit a lot and posture forward, I think you were saying that the disc can be pushed back, creating a bulging disc.
Yes.
Right? Okay.
Yes. Yeah. So again, just to go over that again. So this is looking from the front part of the spine. So this would be kind of like looking through your belly. So if you kind of go from your belly button back, this is what the spine looks like from the front. So all the bones are stacked one on top of the other, the discs are in between. If we were to slice through that disc and look down on it, it is a round ring. So it's a ring of cartilage with jelly stuff in the middle. Almost think jelly donut. That's essentially what a disc is. It's like a jelly donut. The discs are essentially shock absorbers. That's what they do. So that's why they have that sort of jelly stuff in the middle, because they act as shock absorbers to our spine and to our body. So that jelly stuff does move around. Now, our bodies are not designed for us to be sitting 8 hours a day. And I don't know about you, but I know I'm sitting way more now that we're not out and about doing a lot of stuff as well. So I think people, you know, are spending a little bit more time sitting. So when we're in a sitting position, if we sit in that sort of C-shaped curve, my 14-year-old can demonstrate this for you beautifully. You know, he kind of sits all curled up, all kind of around. What that does, because you're in that position, it puts pressure on the front of the disc. So imagine like a custard slice. If you bite into one end and the custard shoots out the other, that's kind of what's happening to the discs. I'm sorry about all my comfort food references, by the way. Jelly donuts and custard slices. So if you put pressure on the front of the disc, the jelly stuff is going to be pushed towards the back. Now that's normal, that's how it's supposed to work. But if you then sit there for 8 hours and you stay in that position, that jelly stuff just keeps getting pressed further and further and further and further to the back wall of the disc. It puts pressure on the back wall of the disc, and that is what will cause it to bulge out. Because even though the disc is tough cartilage, it is still a soft tissue. It's not a hard tissue, it's not a bone, it's still a soft tissue. So if you put enough pressure through that material that's deep inside that sort of jelly stuff, it can start pressing on the back wall of the disc. It will create a bulge. And then, you know, think about people that sit all day long, 5 days a week, you know, 4 weeks in a month, or 12 months in a year, however many years they're going to be sitting. That's a lot of pressure that can go through these discs and force it back. Does that answer your question?
Yes, thank you.
Yeah. Any other questions about any of the anatomy? Because there's quite a lot that can be causing sciatica. There's quite a lot that goes on. All right. Moving on. All right, so treatment options. So there are lots of different treatment options out there, obviously. What I've done for this presentation is just really limit it to what's available to you right now. Because if you're suffering right now, you can't go out and get a massage. You can't go out and get acupuncture like we used to, you know, a couple of months ago. So this is completely relative to right now and the things that you can do for right now. Obviously, physical therapy is still an issue, is still a possibility because of virtual visits. I would say probably 40% of my caseload right now is people with sciatica, because people are now sitting at home. A lot of people are working from home, they're working on laptops, which tends to take us into a poor position if we're sitting. A lot of people are sitting on kitchen chairs, dining chairs, you know, they're not sitting on their £1,000 ergonomic desk chair that they had in the office. So all of a sudden they're in a different sitting position. Some people are even sitting on the couch, as I am right now, sitting on the couch working all day, because it's just, you know, they're making the best of what they can do for right now. So about 40% of my caseload right now is sciatica. It's definitely spiked. And I think that's part of the reason, is people are just they're not used to the sitting positions that they're in right now. So these are things that you can do for right now. Physical therapy is an option. Clinical Pilates is an option. Clinical Pilates is essentially Pilates that is taught by physical therapists. So we use a lot of the classical Pilates exercises, but they have been modified for general population. So just to give you a very brief overview on Pilates, Pilates was developed by Joseph Pilates just after the First World War. And when he first came over to the US, he set up his studio in New York, and he was working with ballet dancers and elite athletes. So he developed a lot of his exercises for that patient population. So they're elite dancers, they're elite athletes, they are, you know, very fit, very well trained. Most people can't do classical Pilates exercises because of the position that they take your spine into. So clinical Pilates has modified a lot of that, so it's accessible to everybody. So we utilize a lot of the principles, but we're making sure that we're doing it more from a rehab aspect rather than a fitness aspect, although it can still work you quite hard. TENS machine is one of the things that I've been recommending a lot of my patients to get at the moment. A TENS machine is basically something that will give you pain relief. It stands for transcutaneous electroneuromuscular stimulation, which is obviously where we shorten it to TENS. And you can get them from Amazon for less than $30. So it's something super easy, super accessible, super easy to use, very safe. It's one of the only things pretty much that we use on pregnant ladies, because we don't touch them with anything. But it's a very safe form of pain relief. So if you have one of those, I'm more than happy to help people either get one if you need to get one, because like I say, I can give you the link to the one that I recommend in Amazon. I think it's like 26 bucks right now. If you need help on setting it up, I can help you with that. If you need help on placing it where you would put it, I can help with that too. But it's something that is really helpful for patients right now when they can't access regular medical or healthcare. They can use a TENS machine. It can really help to bring down pain. Heat and ice, super easy, super simple, but again, can be incredibly effective. So one of the biggest questions I get is, well, heat or ice, which do I use? What's the difference? When do I do one? When do I do the other? So the general rule is, if you have an acute injury, so a new injury, something that's fresh, if it's less than 3 days old, it's ice only. Because if something is new, if something is fresh, if you put heat on it too soon, you're going to increase bleeding, you're going to increase swelling, and then that's not helpful. And that goes for any injury, obviously, not just sciatica. If it's past 3 days, you can pretty much choose. And I tend to say to people, try both, see whichever feels best. If you are feeling more of a tightness, a stiffness, a tension in the muscles, tight muscles, heat tends to work better, just because heat will give you a relaxation through there. Kind of going back to that piriformis muscle, you know, that tends to be a spasm of the piriformis that gives you the sciatic symptoms. So that can respond really nicely to heat because it helps to release that muscle off. So again, if you have questions on either of those, happy to answer that. Heat is one of the things that, I mean, I've always recommended it, but then I had a patient come to see me probably about 18 months ago now, and she was early 30s. She had an injury to her foot, and so it's sort of more of a biomechanical issue, but she was very fit and active. She was actually going to climb Mount Kilimanjaro. That was one of the things that she wanted to do. It was kind of on her bucket list. She was going to go and do it. And so while she was training for it, she developed this overuse issue in her foot. So she'd been to see the orthopedist, they'd done a scan, and she had lost blood supply to one of the very small bones in her foot. It's called avascular necrosis. And because she'd lost the blood supply to it, the bone was essentially starting to die and sort of crumble away. So obviously it was very uncomfortable. So the surgeon or the orthopedist that she went to see, he said, you know, we need to take that out. And she was like, well, look, I'm due to go on my trip in 4 weeks' time. Should have been training for it for ages. You know, can we put it off? And he said, well, okay, you know, if you want to kind of go and get through it, we'll see you when you get back. So she spent that 4 weeks heating this foot as much as she could, like day in, day out, heat the whole time. So her theory behind it was just to try and get an increase in circulation to the area. She was trying to increase the blood flow, which really kind of made sense. She went on a trip, she felt great. She did what she wanted to do, so which was fantastic. She got back, she went to see the doc, and she was like, actually, you know, it feels fine. I don't think I need anything doing. And he said, well, let us scan it again and let's see. They re-scanned it and it had completely healed, which is unheard of. I'd never heard that before with that type of diagnosis and in that type of issue that she had. So it had completely healed. So I am a big advocate for heat. And I know sometimes it's hard when it's like 90 degrees outside, but heat can be really, really effective at getting an increase in circulation to the area. And again, not just for sciatica, but for other things too, as long as you're past that first 3 days. So as long as it's not something fresh and you're past that first 3 days, heat can be really, really effective. Stretches can be very effective too, as long as you're doing the right ones. You know, again, talking about the anatomy and all those different things that can be causing sciatica. Sometimes you need a stretch in one direction, sometimes you need a stretch in the other direction, depending on the cause of the problem. So that's one of the things where I've had a lot of people recently come and say, well, I tried these exercises on YouTube. Of course, that's what everybody does. You know, they go to Dr. Google, type in what they've got and learn about it, go to YouTube, find the exercises and do the exercises. But depending on what's causing the issue, you might have found the wrong exercises, so they're going to make you worse. So knowing what's causing it points you in the right direction for knowing what's going to heal it. Pain pills is obviously something that you can utilize right now as well, pain pills or anti-inflammatories, if they work for you. So that's a very individual thing. I love this picture that I put up here, this abdominal muscle anatomy. This kind of goes back a little bit to the clinical Pilates as well. So you have 4 different sets of abdominals, and the abdominal muscles are really important. You know, when we talk about the core and we talk about core stability, that's really helping to take a lot of the pressure off the spine and to protect the spine. So when we look at the abdominals, there are 4 different sets of abdominal muscles. 3 of them are movement muscles and 1 of them is a stability muscle. So the 3 that move you are not really your core. It's the one that stabilizes you, that is the core. So if we just look at that picture, I love the way they've color coded it as well. It's super cool. So obviously the green is your rectus abdominis. The green is your 6-pack. So basically your 6-pack is your sit-up muscle. If you're doing sit-ups, it's the 6-pack that's working. So therefore it moves you. So your 6-pack is a movement muscle. So because it's a movement muscle, it's not your core. Then you have 2 sets of obliques. So we've got the purple one, which is your external oblique, and you can see the little pink one underneath, that's your internal oblique. So they've cut little holes, like little windows going through, because essentially your abdominals are layers of muscle. So you've got the 2 sets of obliques, the internal and the external. They basically control the turning of your body. So when you're doing sort of twisting crunches, that type of thing, your obliques are working. So they are movement muscles, they're not stability. So the little yellow one that you can see that, you know, we've kind of cut through all those different layers of muscle, we get to the little yellow one, that's transversus abdominis. That's your core muscle. So it is the deepest, sort of the innermost abdominal muscle, but it's a big sheet of muscle. It comes all the way around the, so it's, okay, if we start at the front of the body here, comes all the way around and it attaches into your back and into your pelvis. So it is quite a large muscle, it's just very internal. Now, the fibers of that muscle travel horizontally, so they kind of do this. And imagine if you put a back brace on, that's where your transversus abdominis is. So your transversus is your core muscle. You kind of think back to like the olden days when they used to put corsets on ladies as well and ribbon them in, as they were like pulling those ribbons and the corset goes in. That's the action that transversus has. So it sucks everything in, it takes the pressure off the spine. As it takes the pressure off the spine, it takes the pressure off the sciatic nerve, it takes the pressure off the discs, it takes the pressure off the joints. That's essentially its job. That's what it does. So that is the core muscle of the abdominals. And so it's the most important muscle to be working. It's one of those, it's kind of hard. People used to say to me, well, which machine in the gym should I do to work this muscle? Like, there isn't one. You know, there isn't a machine in the gym. There isn't an exercise that you can do to activate it unless you know how to activate it. And that's the hard part. They've done a lot of research on this muscle, sort of like needle EMG and different things like that. So they've really studied it quite a lot, because obviously we know it's super important. And we know lots about it. We know that it switches off the first time you ever have any back pain. So when you have that first episode of back pain, so like for me, I was like probably around 20. First time you have back pain, that muscle switches off for you. So the most important one that you need switches off. It doesn't come back by itself unless you train it back. So whenever you had back pain, it switched off. Other things that will switch it off as well, pregnancy, because obviously everything gets stretched out through the abdomen when you're pregnant. And depending on how many pregnancies you've had, each time that muscle is stretched out, it's going to switch off. Any kind of abdominal injury or surgery, that will also switch off this muscle, because obviously they're going through it. So think about C-sections as well. You know, like pregnancy and a C-section is like a double whammy. And if you've had back pain during your pregnancy as well, I mean, there's the trifecta right there. So even laparoscopic, so even any kind of laparoscopic surgery, you know, where they do the keyhole, that's still going through these muscles. And what we know is that as you do that, as they go through that muscle, it kind of freaks out, and it's just like, I'm switching off, and that's what it does. Switches off doesn't come back automatically unless you train it. So if you think about how many of those different scenarios maybe you've experienced in your life, you know, we've got to kind of wonder, is that muscle switching on or not? Because it may not be switched on. A lot of fit and active people, and I would definitely put CrossFitters in there, you guys are fit and active, can compensate for a weak core by using those other abdominal muscles. And that's not normal movement, but it does work. It is efficient. Whilst you are still working and still training, it can work. A lot of athletes will do this too. Going back to my sporting previous life, you know, I would see a lot of athletes who could come in, they could do 400 sit-ups, but they couldn't switch on transversus abdominis. So they couldn't activate their core, but the muscles on the outside were so strong and working so well that they were compensating for it. But then when they came to the end of their sporting career, because I work with elite athletes, you know, obviously it's quite a short time span, and they stopped working out as much as they were doing, then they would start to have issues. Because as the movement abdominal muscles started to weaken, because they just weren't working them as much, transversus wasn't working for them underneath. So we've got to make sure transversus works correctly and works as it should do, switching it on. So having said that, there are some, and I'm just going to move this back. Let me just move this out of the way, if everybody can see that. So these are 5 things that you can start doing today that are going to help start giving you some fast sciatica relief. So these are the 5 different things that you really need to be paying attention to. Posture is the number 1 thing. If you did nothing but improved your posture, you would absolutely feel better. So posture-wise, we are designed to have that little curve in our low back. That's called a lordosis, called the lumbar lordosis. So we're supposed to have that little curve in our low back, that sort of little S shape through our spine. So that's why when you're sitting in the car and they have that lumbar support, kind of pushes you forwards. You're sitting in that ergonomic desk chair that we were talking about before, it gives you that little lumbar support, pushes you forwards. You can absolutely recreate this with pillows or cushions, rolled up towel. I would tell patients to, use a rolled up jacket or a rolled up sweater if you're going somewhere and you need to just have something that's going to give you that little lumbar support. That can be really helpful. But posture is the number one thing because of that C-shaped curve, putting so much pressure on the discs and pushing the disc material to the back wall of the disc. Sitting in good posture, having that little lumbar lordosis, that's where the spine is designed to be. It's where there's the least amount of abnormal stress and strain going on the spine, and that's where we want to try and keep it. So sitting puts the most stress and strain on our back. You're actually better off standing up rather than sitting. For some of my patients, if I know it's a disc problem, if I know that patient has a disc problem, I've done the test and that's what it seems to be, I will ban them from sitting. They will not sit. The only time they will sit will be on the toilet, and if it's a time when they were traveling to the clinic, when they were sitting in the car, that would be it. The rest of the time they would eat meals standing up, they would watch TV lying down, they would be working on their computers lying down or standing up, but they are banned from sitting because that disc needs time to heal. And we know that the most amount of stress and strain goes through the discs when we sit. Just a little, as a little aside as well, the discs are more vulnerable first thing in the morning because when we lie down in bed at night for 8 hours or whatever, we take the weight off the spine. So we unload the spine when we're lying down in bed at night. The discs take in fluid overnight. That's quite normal. They're supposed to. It's kind of how they work. So the discs take in fluid overnight. So when we get up first thing in the morning, each disc has a little more fluid in it than it did the night before. So we're actually a little taller first thing in the morning than we are at night. And over the course of the day, as we get up and we our weight goes through the spine, we kind of squish that fluid back out, and then we lie down and it comes back in overnight. And that's normal. That's how the discs work. But what that does mean is that because the discs have a little more fluid in them first thing in the morning, there's a little more pressure in there. The number of people who I see who they get this bout of sciatica first thing in the morning, and it can either be they're bending down to pick up the newspaper, or they're bending down to dry their toes after their morning shower, or they're bending down, and they will say, but I just bent down. I wasn't lifting any weights. I wasn't doing anything challenging. I just bent over. But it's the time of day that causes the problem because the discs have more fluid in them. First thing in the morning, they are more vulnerable. So posture, yeah, making sure you're staying in that good posture. Heat, we already talked about, again, unless it's within that first 3 days of a fresh injury, in which case it would just be the ice. But a heating pad, a hot shower, a hot towel, all of those things can be really helpful at increasing circulation to the area because we want to get fresh blood to the area because the blood brings the building blocks for healing that your body needs when it's trying to heal an injury. But you can also relax off all of those muscles. If you've got muscle spasm around the pelvis or around the spine, that can be uncomfortable in itself. Just think about cramp. If you get cramp in your leg, how painful that is. And we want to release that off. Knee rolling is a super simple exercise that I really like for everybody, really. So this one would be lying down on your back, knees bent up so your feet are flat on the bed, because I tend to teach people to do this first thing in the morning, last thing at night, and you're just going to let your knees roll from side to side. So your feet don't lift up. This is not a core exercise. It's not a strengthening exercise. It's a mobility exercise, and you're purely just rolling your knees from side to side. That helps it moves the joints, it gets the muscles stretched out, it gets circulation going to the spine, to the area. So knee rolling is a really nice one to do. Prone lying, that's basically lying on your belly. Lying on your belly can be one of the best ways to take the pressure off the sciatic nerve. Particularly if it's a disc issue, or particularly if it's coming from the spine, if it is a problem higher up, lying on your belly can be really a nice position to be in. So lying on your belly, because of where your hips and your shoulders are, allows your back to sag through into that good curve that we were talking about. So when you're in that position, the back is in a really good position. There's no load on it. The discs are really happy. So lying on your front is actually the best position for your low back. It's actually the worst position for your neck. So you kind of can't have everything. You've got to choose, you know, choose your poison. But for your low back, it is the best position for your low back. You may find that you need to bend your knees up a little bit. If the sciatic nerve is pretty irritated, you might need to bend the knees. That takes the tension off the sciatic nerve. You can put pillows and cushions underneath your feet. You might even need to put pillows or cushions underneath your hips or underneath your tummy, just to raise you up a little bit, just to make you comfortable. The biggest key to all of this is everything should be completely comfortable. You shouldn't be lying on your front going, oh my God, this is killing me. You know, if it's painful, you're not in the right position. Listen to what your body's telling you. And the last thing is that correct core activation. Making sure we're switching on transabs in the correct way, and making sure we're not getting compensation through the other abdominals, which is super easy too. All right, so there we go. All right, so what you can do, so I have a free ebook, so you can ask me for that. I can send you that. We're doing a sciatica challenge. It's actually starting tomorrow. It's a 5-day sciatica challenge. Basically, we go through each of those 5 different things that I've just talked about. We do 1 a day. So it's kind of like you practice 1 a day. It's a little bit like the self-love and challenge that we're going through right now in the group. So just doing 1 a day, so you can kind of try it out, see if it works for you, and add it in. So you should get a cumulative effect by the end of the week. I do have a Facebook group, Healing Back Pain, during the coronavirus lockdown. Going on a little longer than we had anticipated, but we share tips and strategies in there too. So feel free to come and join us in there. It's a closed group, but anybody is more than welcome to join. And for you guys, I am offering free consultations, completely free consultations with me. So if you want to schedule an appointment with me, feel free to message me, and we can get something arranged. It'll be a virtual visit, so it would be sort of a Zoom type visit. But then obviously I can get your individual story. You can let me know what's going on. We can figure out the structure that's causing the issue, and then make sure you're doing the right things to settle it down. So feel free to reach out to me if you would like to do that. So we're nearly there. What questions do you have? I know I've thrown a lot of information at you there as well. So kind of a lot to get through. Anybody have any questions? Is it just stunned silence? Yeah.
For the TENS unit, so I have one of those.
Perfect.
So, like so it's like my lower back and then like the sides, I guess, of my legs.
Okay.
So would I place the things on my back and my sides, or that's what
So it's both legs you feeling?
More my left than the right.
Okay. Yeah. I mean, generally for TENS can work over quite a large area, so you absolutely could do that. For most people, I kind of say to them, you know, with one finger, put that finger on the pain. So it's kind of like, where are you feeling it? And wherever you kind of like put that finger, it's like, okay, it's there. You kind of want to then get the pads across in sort of like, so X marks the spot. So for example, on your TENS, you've got 2 leads that come out of your machine, and then you've got 2 pads on the end of each lead. So from one lead, you want to go top left, bottom right. And the other lead, you want to go top right, bottom left. So you're kind of crossing the 2 leads over, because you want X marks the spot, and it'll get that whole area, but that's going to be most effective. Does that make sense? Yeah. So try that. The nice thing about TENS is, I mean, it's super easy to use. It can be really effective. Don't put it on so high that you get a muscle spasm though. I don't want you to feel that muscle twitch. If you're getting that, it's on a little bit too high, just turn it down a touch. just so that you're feeling that tingly pins and needles. That's where you want it to be. Put it on for about 15 to 30 minutes is fine. Some people will get a residual effect after that as well. Even when they take it off, it's like, well, I still feel good. The nice thing about TENS as well is you can use it as often as you need to. There's no restriction. Some people who really suffer with chronic pain wear it all day. So there's no restrictions on how much you use it, but it's only going to be effective if you're feeling the pain. So if you have pain, put it on, get rid of the pain, then you're done.
Okay, thank you.
All right, yeah, you're welcome. Any other questions?
I have a question. So activating the transverse abdominal, would that just be a lot more core exercises?
That's a great question.
How do we like activate that one specifically versus others? Yeah.
That's a really, really good question. So, so basically the transverse abdominal muscle, because it's so internal, it works in conjunction with the pelvic floor muscles. So the way I teach patients, I teach them lying down because there's no weight through the spine. The spine is in a good posture position as well. It tends to be in quite a nice posture position there. And you're going to put your hands on your tummy. So if you imagine you're going to put one hand on your tummy below your belly button, one hand on your tummy above your belly button, it gives you a good idea of what those abdominal muscles are doing. You're going to try and suck in your lower tummy. So it's kind of like sucking in your gut. Now, what happens with most people is that all of the abs work together. Because when your brain sends the message down to your stomach to say, okay, come on, switch on, they all want to help. So by consciously thinking about sucking your tummy in, you don't get a pure core contraction because everything works. So the different way of thinking, the different visualization I give people is, okay, let's use a pelvic floor contraction. And so we use Kegels. So if you think about doing a Kegel contraction, if you imagine you're in the restroom, peeing, stop the flow. So that is literally what you're going to do, is you're going to do a Kegel contraction, because the way the pelvic floor works, it works together with transversus. So if we get that pelvic floor contraction, you will get a core contraction. It feels very different to pulling your tummy in and sucking the tummy in.
Yeah, that's very...
Yeah, it is. It's a very different feeling. And so you know that it's very internal. You know you're getting that core contraction. You are getting transversus switching on. That's how you need to be doing it. So it takes some practice. When I teach people this, I say to them, okay, you're going to switch that muscle on. So think about, okay, switch on. Keep it switched on. Keep breathing normally, because again, it's not a and holding your breath, because if you're holding your breath, we can't walk around like that all day. So you want to switch that muscle on and keep it on. Keep breathing nice and normally. So hold it for about 10 seconds, then release it back off. Switch on again. Keep breathing normally, hold for 10 seconds, release it off. You do 10 repetitions, and you do that every hour through the day. So it's kind of little and often. The thing with transversus is it should be switched on for you all day long. And for most people, it's not, because we're just not working it in the way that it's designed to be worked. We've had back pain, we've had pregnancies, we've had surgeries, these things have happened, and it's started to switch off and off and off and off and off. So for most people, it's not doing what it needs to do. We need to get it switched back on, because it should be on at a low level for you all day long. It's a marathon muscle, it's not a sprint muscle. So when we think about sort of like, if we're working biceps, we were doing bicep curls, we would switch on, switch off, switch on, switch off. Transversus doesn't work like that. We want to switch it on just a little bit and then keep it on. So it's more endurance. That's what the core muscle should be doing. Does that answer your question?
Yeah.
Okay, great. So get practicing. Any other questions?
I had a quick question.
Sure.
Do you suggest doing those stretches in the morning even when you don't have any pain? Like just as a general, like wake up and do those stretches for like 5 minutes or so? Daily?
Yes, absolutely. Great question. Yes. So there are 2 different sets of exercises that I do every morning and every evening. That's one of them. Just because it's really good for spine health. If you start doing things now that are really good for spine health. You know, in 20, 30, 40 years time, your spine is going to be thanking you for it, for sure. So that's one of them, the knee rolling from side to side. It's super easy, but it just ensures that you're getting good range of motion through those joints. And it keeps the joints healthy. The way that joints get their nutrition is by motion. Joints are designed to move. It's what they like to do. So if joints are not moving normally or not moving as much as they should do, they start to complain at you. They start to get stiff and sore and uncomfortable. So this is one of the ways that you can keep those joints moving, but you can also, because the joints get their nutrition that way, essentially the two joint surfaces are moving over each other. It pushes the fluid out of the cartilage on the ends of the bones. That bathes the joint, it gets its nutrition that way. So that's how joints get their nutrition. So that little knee rolling from side to side only has to be 10, you know, literally like 1, 2, 3, 4. So it's really super fast to do, but it really helps to give the joints the nutrition. But yeah, 10 in the morning, 10 at night. It'll take you 10 seconds each time. It's super fast. Okay. But that would be great. If you start doing that, that's a really good one to do.
Thank you. And I have one more question.
Sure.
I tend to like throw out, I think it's my sciatica, whenever I bend over and pick something up. Mm-hmm. And I always thought it was because I was doing something with like picking it up in the wrong way. Does it have anything to do with that? Or is it just about like me having tight muscles that I haven't stretched out?
I mean, it could be any of those things. Okay. It may well be. It depends how you're picking it up. You know, if we go back to the posture, if you are going into that C-shaped curve and putting a lot of pressure on the spine, it can be that. I mean, it could be that you are bending over in the correct way, but maybe that piriformis muscle is just tightening, and that's what's giving you the sciatica. It could be that your core muscle is not activating correctly, and so that's not supporting the spine, so the spine is just complaining about the amount of stress and strain that's going through it. Okay. So it could be any of those reasons.
Okay, thank you.
Yeah, sure. Any other questions?
I have a question.
Yeah.
As far as when you're sleeping, is there an optimal way to sleep if you're suffering from sciatic pain? Like, should you elevate your feet or somehow, or?
That's a really good question. Again, ideally on your belly is the best thing for your low back and the best thing for sciatica. Now, not many people can sleep on their bellies. You know, it's a small proportion that can. So what I say to people is when you get into bed at night, spend 10 minutes lying on your belly, if you can, if it's comfortable. So you get into bed, get onto your belly for 10 minutes, to allow sort of all that disc material, if you like, to come back into the center of the disc where it should be. You allow the spine to relax off. You might need to bend your knees up when you're on that, when you're in that position with pillows and cushions. You might need to put pillows and cushions underneath your tummy or your hips just to raise you up a little bit. But being on your belly is a very good position for that. Now, when it comes to actually sleeping, most patients who have sciatica tend to find being on their side is a more comfortable position than being on their back. When you're on your back, the spine can sag through into that, it's more of a straight spine position because there's no support for that little lordosis. I have recommended to people in the past to have like a little rolled up towel. You could try and sleep with that. Again, it's not the most comfortable, but if it keeps you in a good position, it can help. If you were to be on your back and raising your legs up, that's actually going to tension the sciatic nerve even more, and it's not going to like that. Sometimes bending the knees, if you think about sort of like a lying down chair position, you know, if you were lying flat and you had your legs up over a chair, so you were at 90 degrees at the hip, 90 degrees at the knee, sometimes that can take tension off, but everybody's individual. Most patients prefer to be on their side, more in the fetal position, because by bending your hips and your knees up, that takes the tension off the sciatic nerve. Does that answer your question?
Yes, thank you.
Yeah, there's kind of no gold standard. There's no one way. Again, it would be very individual. I apologize for my children in the background. Any other questions?
I have a question. This is Erica. I have been having back pain, and one of the things that it could be placebo effect or maybe not, but we've been using tape, and I just wanted to kind of hear your opinion on whether that's helpful or beneficial, or or just, I guess, just your general opinion on whether like I can keep using it or if there's options.
You were breaking up a teeny bit. Tell me what it is again. What is it you've been doing?
KT tape.
Oh yeah.
I just wanted to know like your general opinion, because sometimes it kind of feels like it's more of like a placebo effect, and I don't know if it's that or if it's actually working. So
okay, so KT tape, when KT tape first came out, obviously it was a few years ago, I've always done a lot of athletic taping with being in sport, so that would be the more like traditional, you know, kind of like rigid tape. And so when KT tape first came out, I was so skeptical about KT tape, and especially with kind of the claims that they were making with it, I was kind of like, yeah, right. I didn't get it at all. At the time, I was working with a guy who had a knee surgery, and he had the biggest swollen knee that I've probably ever seen. He was really, really struggling. So one of the claims for KT tape is that it takes down swelling. And it's basically the way the glue is in that wave formation on the back of the tape. So I kind of, you know, I've tried all kinds of things with this guy, and I was like, this is supposed to do this. I don't know whether it will, but let's try it. So I put the KT tape on to reduce the swelling in his knee, and he came back the next week, and we both went, oh my goodness, because that swelling had gone down. So it does work. It's not just placebo, it does work. So to reduce swelling, basically what it does, it lifts up the layers of tissue to allow free flow of fluid underneath the tissues, and it does do that. You know, I can say absolutely it does because I've seen it. The other really big success I had with KT tape was with a lady who had, she had sort of like rib pain. She'd actually had lung cancer, and they'd done a lung resection, and she was getting unremitting nerve pain around her ribs. And so the surgeon had told her they thought the nerves had been caught in the scar, and there was nothing they can do. So it's just kind of like you kind of have to live with it. It's one of those things. So she'd had this pain for 18 months. She came to see me for something completely unrelated. And so I was actually using KT tape on her leg for something completely different. And she told me about this rib pain. And I was like, well, let's try it. So I put it on there, kind of tensioned it in a particular way that I thought it would take the tension off it. And she just looked at me and she was like, I have no pain. She's like, my pain is gone. I was like, she cried, I cried. I was like, oh my God, it's like magic tape. So I do actually call it magic tape. So if you're using it and it's working, then
well, and so then the follow-up question would be, is it something that I should be using like constantly, or is it just when my pain is especially unbearable, or when I'm working out? Like, what is the, I guess, recommended usage?
Yeah, so I would say when you need it. Try and not use it all the time. If you're using it all the time, the skin's going to break down, and then you're not going to be able to use it, so that can be a problem. Hang on 1 second. Boys. Sorry about that. So yeah, if you don't want to get skin breakdown, that's the biggest thing with using any kind of tape, because if your skin breaks down, you're gonna have to stop using the tape. Milk of magnesia is actually really good just to put on it after you've taken the tape off. Just do a little rub through with milk of magnesia. That really helps the skin.
Okay. Yeah, I have noticed that I do get like my skin is red or like irritated.
Yes, yeah. So we don't want that to break down, because then you wouldn't be able to use the tape. So get yourself some milk of magnesia, put that on after you take the tape off. But only use it when you need it. So if you know you're going to be doing something where you're going to be uncomfortable, put it on. But ideally, we want to get you to the point where you don't have to use it. You know, there's clearly something, there's something that's irritated, there's something that's unhappy. So let's figure out what that is, how to fix it, and then you won't need to use the tape anymore.
Yeah, definitely. Okay, thank you. That was
You're welcome. Good. Any other questions? I love questions. Anybody else? All good? Great. So this has been so fun. I really enjoyed doing this. So thanks so much for joining me for this. I know when I put the poll in the group, shoulder impingement is definitely something that, again, if I'm seeing like 40% sciatica patients right now, I'm seeing 40% shoulder impingement patients right now too. And I think it's because we're all working out at home, we're all doing different things, and everybody's getting shoulder impingements. So if there is enough interest, I'm more than happy to do a little talk on that and help people through that too. But please feel free to reach out to me. I am in the community Facebook group, so please feel free to reach out, you know, message me. If you have any questions, I'm more than happy to help you guys. I'm here for you. So if you have anything, and you know, even at the end of this, if you're like, oh, I didn't ask her that, just feel free, reach out. And if you need me, let's jump on a consult, you know, and we can chat through your particular issue and get you doing the right things. Because at the end of this, we want to make sure we all come out of lockdown completely fine, ready to hit the ground running again.